Are you the parent or caregiver of a child who's in elementary school? And you might start to be concerned about the R sound. The R sound is a very tricky sound in speech sound acquisition. You might be wondering what age a child usually acquires the R sound, what types of R sounds there are, and what you can do to help your child acquiring the R sound. Well, you've come to the right place. Hi, my name is Amini. I'm a speech and language pathologist with several years of experience working with children and their families to maximize speech and language development. I have a private practice, Smarter Speech, in the Bay Area where I do the same. And my mission with this YouTube channel is to empower parents and caregivers with little tips and tricks to boost speech and language development when a child's brain and learning are developing so rapidly. So without any further ado, let's jump into it. R. So normally with elementary school children, I expect R to be coming in. That means to be there once in a while, around the age of 6. It might come in earlier, it might come in a little later, but I start to watch for it around the time a child turns 6. We call this emerging. When a sound is emerging, that doesn't mean that it's right all the time. It just means at least a few times your child is experimenting with how to make the sound. They have an awareness at least once in a while of how to make the sound. So up to 6 is when I look for it to start emerging. But the good news is R can develop all the way up to age 7 and age 8. So if your child isn't saying the R completely correctly at 6 or 7, you might not need to worry yet, but around 7 to 8 is when I really start to look to see if a child can say their R. If they're not able to say it, that is a good time to reach out to a speech therapist, mention your concerns to a teacher at school. So you can give up to 8, but around 6 is when you would start to keep your eye out for it. In terms of what are the types of R, there are actually 2 types of R, and we can say either one. It really just depends on the type of R that was modeled to you and the type of R you find most easy to produce. So the 2 types of R's are the tip R. So that's made by the tip of the tongue curling back like this, R, like that. And the other kind of R is when the back of the tongue lifts to make an R, like R. R, like that. There's a little bit of a slight smile and the back of the tongue lifts. Both of them are fine. I find that tip R is a little bit easier for me, especially in languages. If the R is already rolled, like in Spanish, like the R, you're doing just a slight modification to that to make the American English R. So tip R in that case might be an easier one to learn or an easier one to produce, but it doesn't matter. Both of them are fine. So those are the 2 types of R's. And normally, when you're looking at how R emerges, it doesn't all come in correctly at once. So this is a really important thing to know because a lot of times I'll hear parents say something like, oh, well, I'm trying to correct their R, like I stop them when they're talking and the R doesn't correct. That's probably pretty typical. So normally in speech therapy, when you're getting a sound, you get the sound at the sound level first. That means that a child should be able to just say R, like a pirate says R, correct around 80% of the time before they can say syllables with R. So for example, ra, re, re, ro, ru, or ara, ere, iri, oru, oru. Those are all just syllables that you can make with the R sound. So that usually comes next in therapy, and the child should be able to say that around 80% of the time. Only then does the child say R in words. So things like run, red, arrow, car, all of those come only after a child is able to say that sound and those syllables correctly. Then a child is able to use those words in sentences. So the car is red, for example, and only after a child says approximately 80% of those sentences correctly does a child start to say the R correctly in conversation. So that is a long progression. So expecting them to correct in conversation with just a few prompts probably will not work and will probably be more frustrating for the child. So if that's the case, then how can you help them? Well, there's a few options. One option that I tell parents is if you're concerned, obviously reach out to a speech therapist sooner than later. That's a huge one. because as much as you want to help them, you are not a therapist. You can't quite replicate the environment of therapy. But if you want to help your child, one of the best things that you can do is just repeat or hold it out over and over again in conversation. So for example, if you guys are going somewhere and you're talking about your car, go ahead and say car a bunch of times with that really exaggerated held out R. So, oh, time to get in the car, or that's my car. You'll sound a little silly, but the good news is that your child can't control what you say. So you're not asking them to do anything, you're doing all the work. Your child will start noticing where R's happen in daily routines and in which kinds of words the R sound happens. They will kind of, especially if you're holding out the sound, they'll notice the way that you're making it, at least subconsciously, and that helps them a great deal. So just doing that, even 10 to 15 minutes a day, can really help your child notice the R, notice how it's made. If you really want to help your child and you have a child who will not get frustrated with trying to correct, one of the things that you can do is find a nice handheld mirror, hold it up, and show your child how you make your R. So you can either talk about those two R's that we just learned about, so that you can say, oh, I moved the tip of the tongue back, R, or you can talk about how you move the back of the tongue up, R. Either one, you can demonstrate to your child and have your child try to copy you, maybe 3, 4, 5 times in a day, not more than that. But with time, they might just watch you and get a hang of how to move their tongue, which would help them in the process of acquiring that R. Beyond that, I really don't recommend stressing too much as a parent, besides making that referral to a speech therapist, just because with speech sounds, it's always a good idea to be delicate and to keep the child's mental health and happiness in mind. So they might not really like being corrected all day long, so we should try to avoid that as much as possible. So those are our things we've learned about the R. So starting at around 6 to around 8 is when I would expect that R to start coming in more. 2 types of R are tip R and curled R. And what you want to do is emphasize this R in routines, maybe even show your child just how you're making R like you're playing the pirate game for a couple of times a day. That's plenty. And of course, if you are concerned about R or any other kind of articulation, it's a great idea to talk to a speech therapist near you, talk to a teacher if you're at an American public school, to make a referral for an assessment if your child is getting to 6, 7, 8 and still doesn't have their R. So that is kind of the gist on R. If you're looking to find out more about speech sound development for a child who's between the ages of 5 and 8, you can check out some of the resources below. There's an ebook on speech sound development in those ages. There's also a parent education course if you want to find out how to very easily and without much stress help your child with speech sounds. These are meant to be used in addition to work with a speech therapist. I hope that you enjoyed this video. Thank you so much for watching. If you did, consider giving it a like or subscribing to get more tips on articulation. Happy talking.